In terms of understanding anatomy for an open repair in a preperitoneal position, this is a tool that's very helpful in terms of identifying the layers that are critical. Most surgeons are obviously familiar with the standard dissection of an inguinal hernia repair from an open technique, but a tool like this sometimes gives us an opportunity to take it layer by layer, and so we'll do that just for some explanation in terms of what are the important steps for the performance of an ULTRAPRO hernia system repair with a preperitoneal placement of the underlay mesh. So for the sake of discussion about it in terms of layers of dissection, obviously the first layer of fascia we encounter is the external oblique aponeurosis, which forms the external ring. If we remove this layer for demonstration purposes, and then the next layer obviously is the internal oblique, and we see some of the nerves of the abdominal wall appearing in this area as well, obviously to be avoided during dissection. And we're beginning to see the floor of the inguinal canal here as well, and the internal ring is the area where the cord structures ordinarily would traverse. The deep epigastric vessels in the rim medially of the internal ring are a critically important landmark anatomically, because the objective of placing the ULTRAPRO hernia system underlay portion is to go beneath the epigastric vessels and enter the preperitoneal space beneath those vessels. So as we take this next layer off, we'll begin to see that a little more clearly. Here is the transversus abdominis muscle and its aponeurosis, the internal ring, the lateral triangle, and the medial triangle in this area. So our primary objective in placement of an ULTRAPRO hernia system procedure is to place the underlay portion of the mesh in the preperitoneal space beneath these epigastric vessels. So eventually at that point we'll have medial, femoral, and lateral triangle deployment of the mesh. So that's basically the concept of the underlay portion of the UHS, to occupy a space created by preperitoneal dissection, giving full deployment of the mesh over the myopectineal orifice, covering the medial, lateral, and femoral triangles.